Welcome back in to WKYT as our noon news hour continues. Do you have high blood pressure, or do you know the risks and the treatments that are available?
Well, it's a very important topic, and we're joined by Dr. John Kotter with the UK Gill Heart Institute, along with Joe Maggard from the American Heart Association. Yes. Thanks for coming in today.
Thank you.
Thanks for having us.
Doctor, we appreciate you coming. And tell us, what are the risks when you have high blood pressure? What is going on with the body?
Yeah, so high blood pressure, which some people call hypertension, is a really common problem. And what it does is it puts extra stress on the blood vessels throughout your whole body, and that in turn leads to cause problems of heart damage or kidney damage and puts people at risk of having heart attacks or strokes or kidney problems.
How is it usually treated? And I understand you may have some experimental treatments out there too.
Yeah, so most of the time people use things like dietary modification, eating less salt, losing weight, exercising. Those things are all important. If people need more than that, some medicine oftentimes is used. And now there's some experimental therapies where we're trying to investigate if we can't alter the way that the signals that your body creates in order to cause the problem of the high blood pressure, if through a minimally invasive procedure, if we can't do something to actually fix that at its root.
Well, that's exciting.
Joey, the American Heart Association is trying to get this information to people, and it's pretty important that we all be pretty aggressive in finding out what our risks are.
Very much so, and this is a primary concern for the Heart Association. You know, we've done a great job reducing death and disability from heart disease and stroke over the last 25, 30 years. One of the things that stands out is blood pressure, that we're not really making the progress, and thus the type of research that Doc's discussing here. One of our very, very important partnerships is with the American Medical Association, and we've developed a program called Target Blood Pressure, which we'll be rolling out through practices throughout Central and Eastern Kentucky over the next year or so, working with practices on the latest protocols and latest procedures to try to address this as well. So a good time to be supporting the Heart Association and be aware of what we're doing in the community.
And certainly if you don't know what your blood pressure is, you need to know.
You need to know.
That's right.
Most definitely.
Right.
And take
Thank
your
you.
medications
And
as
take
well.
your medications.
Yeah.
Thank you so much for coming in.
Thank
We
you.
appreciate it.
Yeah.
Thank you.